In this video, let's talk about the normal chest x-ray findings. So whenever you are looking at the chest x-ray and reporting any chest x-ray, you need to address some questions. There are 9 to 10 questions that you need to address. Okay. So first question, when you look at the x-ray, first question you need to answer is whether it is a AP view or PA view. First, let's talk about the PA view. In PA view, what you need to see is you need to see the sternoclavicular joint and acromioclavicular joint. They should not be at same level. Then you need to see this scapula. It should not overlie the lung fields. Okay, it is outside the lung field, so this is a PA view, right? And you need to see this cardiac shadow. It should not be larger. So in this you can see that acromioclavicular joint are not at same level. The scapula is not overlying the lung fields and heart is also looking normal. So it is a PA view. In AP view, it will be opposite. That is acromioclavicular joint and sternoclavicular joint. This will be at same level. Okay, the scapula will overlie the lung fields and the heart will be weaker. Right? Then, what will be our next question? You need to see whether the X-ray is taken with full inspiration or not. So how to come to this is you need to count the ribs and you need to count the left side ribs, and you need to see that the anterior end of the sixth rib should be above the left dome of the diaphragm. So let's see how we can do this. See, this is rib 1, 2, 3, 4, 5, 6. Now trace it. Okay, the anterior end of this rib is above the left dome of the diaphragm, right? So it is normal, that is, it is taken after full inspiration. If it is not taken with full inspiration, then there will be crowding of the vessels in the lower lobes, and it will be misdiagnosed as some type of pathology in the lower lobe, mostly consolidation, right? Then next question you need to ask is whether it is rotated or not. For this you need to draw a straight line along the spinous process of the thoracic ribs. You need to count the distance from the straight line to the sternoclavicular joint on both the side, and this should be equal on both the side. If it is equal, then it is not rotated x-ray. Okay, and what is the importance of this is if the x-ray is rotated, okay, there will be unequal distribution of the x-ray, and one side will look brighter while other side will look blacker, and so you can misdiagnose it as some kind of consolidation while there is no consolidation on the particular side. And also this mediastinal shadow will be affected. Okay, the side which is rotated, there will be more enlargement of the mediastinal structures on that side. For example, if the patient is rotated on the left side, okay, the distance here on the left side will be increased, and this mediastinal structures on the left side will be seen enlarged, and you can misdiagnose it as some kind of pathology while there is no pathology, it is just the rotated x-ray. The next thing what you need to see is you need to see this lung fields. Okay, here it is normal. Then you can see the trachea. Okay, so this is the trachea, this is the carina. Okay, this part is carina. To trace out the trachea. Then next thing you need to see is this aortic knuckle. Okay, this is the left side of the heart border. This is left auricle, this is left ventricle, this is right ventricle. Okay, and this part is inferior vena cava, this is superior vena cava. Okay, and let's see that this is the left dome of the diaphragm. It should be clearly visible on both the sides. Then you can see this costophrenic angle, it should be clear. Okay, if there is a opacity here, then it is most likely to be pleural effusion, right? Then you should look at the ribs. Okay, there should be no pathology in the ribs. In the patient of trauma, you can find rib fractures. Okay, then you can see the joints here, the various joints. You can see the scapula. Then you can also look for the soft tissue around, because there can be air inside the soft tissue, which can uh, be because of subcutaneous emphysema. Okay. These are the pulmonary vessels. Okay. This is the bronchus. This is the bronchus. So this is the characteristics of the normal chest X-ray, and you need to look all this when you are seeing any chest X-ray. There are also hidden areas. Okay, the hidden areas are the apex, then the heart. Okay, that is retrocardiac region, which you cannot see clearly in this uh, frontal chest X-ray. Then this costophrenic angles. Okay, then cardiophrenic angles. Then below the diaphragm. Don't forget to look below the diaphragm, because there can be perforation of the bowel. Okay, and you can see the air under the diaphragm. So you should not miss this, because this is a emergency. So you need to look below the diaphragm also. So yeah, that's all for this video. Hope this video was helpful to you, and thanks for watching.